The Ministry of Health and Social Services, Dr. Bernard Fink, together with the United States Ambassador to Namibia, Thomas Doughton, launched a new web-based program system to manage medicine stock countrywide. This will ensure that state pharmacies and dispensaries do not run out of medicine. And in recent weeks, state pharmacies and dispensaries ran out of critical medicine because the ministry did not have an effective stock control system. But joining me in studio this morning with more is Lazarus Ndongo, Deputy Director of the Division of Pharmaceutical Services at the Ministry of Health and Social Services, as well as the newly appointed USAID country representative, Mr. Brian Fink. Gentlemen, a very good morning and welcome to the show.
Good morning.
Good morning now.
All right. Mr. Ndongo, I'm going to start off with you. But telling our viewers this morning what the current system that is in place right now, how is that used to monitor and to manage medicine? As we've mentioned, that there was a time, effective, or we ran out of crucial medicine stock. So let's talk about the current system.
Yeah, first of all, allow me to acknowledge the United States of America, which have brought the system now currently, which is enhancing Namibian to have a stock control system. Currently, in our ministry, we have used the EDT, which they call it the electronic dispensing tools, started in 2005, and also this also was developed with help from the USAID, and that is managed medicine and patient on ARVs, antiretroviral therapy. And in the other side, for instance, for the facility, other medicines, like medicine and supplies, clinical supplies, we are doing it with manual-based, which we call it stock card. So this is what is used in the facilities. With Central Medical Store and Regional Store, they have a system which they call it CISPRO system. This is currently a system which we're using.
We were using, okay.
Yes.
All right, we'll get to the new system just now. Mr. Fink, also before I get into, the details with you, like I mentioned, you are the newly appointed USAID representative. So for our viewers there, briefly tell us about yourself, your experience in your field. That'll be really nice.
Sure, thank you very much for having me. Yes, so I just arrived here in Namibia about 2 months ago with my wife. We were recently posted in Ukraine, where I spent the last 4 years. It was a very interesting time there. I'm very happy to be here in Namibia, where things are calm and the relationship with the government of Namibia is so close, and we're going to have a great partnership here over the next couple of years.
Fantastic. All right, so now do tell our viewers as well, there is what the function of the pharmaceutical dashboard or information dashboard is.
Sure, thank you. So it's really quite simple, actually, what the dashboard is, and it's all about getting the right medicine at the right place at the right time, and about saving lives. So what it is a computer-based system, a web-based computer system, which tells you what stock is available in which locations across the country. And to put it really simply, as my colleagues told me, it's like the dashboard on your car. It tells you how much petrol you have, how fast you're going, and when you're going to run out of fuel. It's the same thing with essential medicines, vaccines, and clinical supplies across the country. It allows managers to see where things are, in which places, and when they need more.
Fantastic. Back to you, Mr. Ndongo, in terms of the measures that are taken, with state pharmacies and dispensaries. All right. Like Mr. Fink also mentioned, let's talk about the fact that this is a computer system, program system, as we've mentioned.
That's right.
And technology isn't always on our side. So what measures are in place to keep this running all the time?
Yeah, measures are there in place to keep this running all the time. As the most important is the people who are running it, that they are really dedicated to do that. And also another thing, what we look at it is we need a training of the people, and also the dedicated, as I said, staff members for the ministry, and the best to do so. Yes.
To do so.
Yeah.
All right. Now we understand that the system also includes you basically spoke about the early warning system. Can you elaborate some more on that for us?
Sure.
Please?
So if I go back to the analogy about the car, it's like the low petrol light on your car. And what it will say is that there are certain medicines that exist across the country, and it'll let you know when they have a certain amount of months left in stock. So if there's enough test kits or certain vaccines, it'll tell you in the system you have this many months of this amount of stock left and where that stock is located. But also it'll let you know that if you have enough stock in a neighboring region or a neighboring district health facility, that you could move that stock to the places that need it. And it allows the ministry to do that quite quickly and know immediately where those shortages might be and where they have enough stock, and they can move that stock where it needs to go.
Right, right. Did health professionals already receive training? I mean, this is a newly launched system, but has training started for them already, Mr. Ndongo?
Yes. Currently, as we said that 15 hospitals were already done, and now we still have also to go with other 20 hospitals. We want to include all 35 hospitals. So during that period, all those pharmacy staff were being trained. Yes.
All right. Well, in that case, the system, when will it be up and running, Mr. Fink? We mentioned it's newly launched. When will it be up and running?
Right. So the system is already up and running for 15 district hospitals around the country, and it's our expectation that in the next 6 months we should have rolled out completely for the entire country.
Okay. We're hearing really good stuff about the system, and it's really positive, and we're making strides, by introducing this system. But can we talk about the disadvantage of this system? What could it possibly be? What are some of the disadvantages?
Well, I think like any system, it's about the data that you put in the system and the people that are trained for it. I think the minister has just said that if he wanted to know how much of a certain drug was available within the country, he would have to send out a paper request to all of the district hospitals, and they would have to count and tally how much of any medicine they had. And that could take up to a week to get an answer. Here with this system, they can look immediately and see what they have, when they're going to run out, and when they need to order more, giving the ministry months more notice of when they need to do their ordering, and so that there won't be shortages in the future.
Okay, so and how many other countries have used this system before?
So there are countries across the world that use this system. This is a best international practice. Of course, each system is tailored to the needs of that country, and so this system is unique in the world because it's tailored just for Namibia. And it's really a testament for any government to implement a system like this, because it shows that they care about the medicines that exist in the country, and they care about people getting those medicines, and they care about Namibians' health.
Absolutely so. All right, final words from gentlemen, starting with you, Mr. Ndongo.
Yes. Yeah, what we are saying that this is a newly system, and I think that I just urged all the managers to use this appropriately, so that we can control the availability of medicine in the country. Really, if we are dedicated, because the tools can be there, but if people are not dedicated themselves to do it, then nothing will happen. Okay. So I just urge our ministry, and they are also really, we are dedicated to do so, and I think that it will help Namibian to have stock in place, in order, on time.
And on time.
Yes.
All right, Mr. Ndongo, thank you. And you, Mr. Fink?
I think this is just one more great example of partnership, of Namibian-led partnership with the United States government, and I look forward to doing many more examples of cooperation like this over the next couple of years.
All right, fantastic. Thank you so much for being here, and we wish you all the luck and welcome to the country, to our beautiful country.
Thank you.
All right, there you have it. That was Mr. Lazarus Ndongo, who is the Deputy Director of Pharmaceuticals at the Ministry of Health and Social Services, and USAID country representative, Mr. Brian Fink, here chatting to us. That is about a new system that has been implemented at the government to monitor stock at pharmacies and dispensaries. Very good. We certainly are making strides in the country. We'll be back after the break.